Hello everyone, this is Ali, one of the pediatric residents, PGY2 in Texas Tech, El Paso in Pediatrics. Today I'll be talking about aluminium phosphide poisoning or zinc phosphide poisoning. Both of them are equally, I think aluminium phosphide is more toxic in general, but usually they come in two forms, whether aluminium phosphide poisoning and zinc phosphide poisoning. The reason why I'm talking about this topic specifically is because previously when I was in Egypt in my previous residency in emergency medicine and in my internship, we used to see a lot of aluminium phosphide poisoning, and we used to call it in Arabic which basically means like the grain pill, because it's mainly used with like a pesticide, a rodenticide actually, by the farmers, and it was an easy, cheap method of getting rid of them. The biggest problem with it is, since it's very commercially available and it's very cheap, we sadly used to see a lot of suicide from it than more than anything else, and to an extent the mortality rate in these patients were very extremely high. So when I started my residency, I was very curious about different types of management, and that brings me to the following. So basically, in the US, back in 2017, there was 12 patients that got affected by it, and 4 sadly passed away, and these 4 were pediatric patients. Of the 12 patients, there were 4 first responders, whether they're police departments, whether they were firefighters or paramedics, and there were families of 7. Sadly, the story goes as the father got this aluminium phosphide pills and he left it in the barn, and then I think was dry and he hosed them, and then fumigates came out of it, and the whole family inhaled it sadly over a few hours. So there were 7 family members, 4 arrested. Sadly, the 7-year-old arrested on scene. There are 3 siblings, age 9 and 11 and 17. I believe 2 of them arrested in the ICU, the pediatric ICU. The 17-year-old through thorough resuscitation in the emergency room. After that, she arrested as well, and the mother required ECMO for about 3 days and continued to be intubated for about 5 days, but then she made the full recovery, and the rest kind of did the full recovery within 2 or 3 days of the incident. So that being said, so basically this is the aluminium phosphide tablets. You can see they kind of look like normal grain pills to an extent. You can see it's very, very cheap, as I mentioned before. It's very potent, and it's a very toxic rodenticide. It's very effective. Again, it's mainly used to protect the grains, and this is kind of its name in Arabic, as I was mentioning, called orsaghalla. That being said, it's commercially available as that dark gray pills. At times it's like 3 grams in each pill, but I found multiple sources for it. So at times it's aluminium phosphide, accounts for more than 50% of the fill of that pill, and about carbamate is about 44%. And these are some of the commercial names for them. That being said, I think the one that was used in the incidents was the Evoside. I think that was mentioned in the Clin Toxicology report. That being said, you can see these are all others commercial names for it as well. So basically, this is one of the commercial websites that I found that it shows that the description for it is simple. It comes in about 2,500 pellets per flask, and each 5 pellets liberate about 1 gram of phosphine gas. And as I said, once we will talk about it more, that the big thing about it is once it turns into that fulminate, people breathe it, mainly that gas is colorless and odorless in its purest form. However, in the presence of a substitute for phosphine or diphosphine, it causes this fishy or garlicky smell. And it's people will tell you if they have the alert mental status that they smelled that before. I think it was one of the common things I heard when I dealt with these patients. So, signal words usually in toxicology is like danger, warning, or caution, and it depends on the level of toxicity of each of those. So, you'll see that, for example, danger is a highly toxic substance, and it basically causes toxicity based on from 0 to 50 milligrams per kg of it. I know 0 sounds weird, but I mean, basically, it's highly toxic that even in minimal quantities can cause high toxicity. Toxic levels is about 50 to 500 milligrams per kg, and the label usually is warning, and less toxic is usually 500 to 5,000 milligrams per kilogram. That usually has a label called caution. Aluminium phosphide is a highly toxic substance, so you'll always see that danger signal on it. Again, it's basically 500 milligrams of phosphide is toxic, and the mortality rate can reach beyond 37%, with low survival rates if 1.5 grams were taken, and that's basically it's toxic at 500 milligrams, and usually mortality rate increases by that 1.5 grams. So, mode of toxicity of it, as we've mentioned before, can be inhalation, which is basically phosphine gas. Can be inhaled, which, as we mentioned, if it's basically irrigated by water, what happens is interacts with or it's exposed to air, it interacts with H2O molecules in the air, and it changes to phosphine gas. Usually it tells you it is detectable under 2 particles per million. However, that is not a reliable measurement to tell you whether it's toxic or not, because I could not find basically what parts per million will you be smelling it at. And then also there's oral exposure to it, or basically we see it mainly with suicide, intentional ingestion, and basically because it interacts with the gastric acidity. Dermal exposure happens, and then really important that the healthcare providers that are caring for these patients make sure to have their own safety measures, because it can happen from MSS feces or lavage. Any technical which is going to go through dermal exposure or inhalation as well, because again it can go into the air from the patient itself, based on how it interacts. There was a question, or usually a conception, that which one is worse, right? Was it the ingestion of a fresh rodenticide in its original packing, or if it's already open? Technically, the ones in the original packaging is more potent, and that's because if it's already open, lots of the phosphide interacts with the H2O in the air and becomes phosphine gas, which dissipates. So basically, if you're taking or ingestion original closed packaging, that would be highly toxic because it has more concentrated matter of it. And basically, the mechanism of toxicity, as we see here, is going to be, basically going to be, it blocks the oxidative phosphorylation and the electron transport chain. When that happens, and it happens by non-competitive inhibition, so it just blocks it, that affects the cytochrome oxidase in the mitochondria. And when the cytochrome oxidase is affected, it just releases all of that oxidant materials, right? Releases all of that oxidative materials over here. And that produces basically damage on a cellular level, because basically the cell goes into energy crisis and it cannot produce enough ATP or enough energy, and that is mainly affected in the cardiac and the vascular tissue, which causes cellular hypoxia, and that cellular hypoxia will lead eventually to circulatory failure. And it's one of those types of shocks where you'll see that patients go in that as a mitochondrial shock, which is basically a mitochondrial shock, right? So it's one of the irreversible shocks to an extent. So signs of symptoms, right? So basically, you'll see that varies from minimal, basically GI, from the vomiting with fishy odor, the hematemesis, abdominal pain. You'll see that chest pain, the bradycardia, the tachycardia, and these are usually arrhythmias that occur early in that course of the disease. Eventually, what happens is that congestive heart failure secondary to the global left ventricular hypokinesis, and this is why patients eventually requires ECMO if that is affected with low ejection fractions and reach criteria for ECMO. It causes that refractory shock and high anion gap metabolic acidosis, and it's usually because of the phosphine gas. And then the hemorrhagic pulmonary edema, you'll see some electrolytes imbalance as well that occurs with it. So basically, prognostic values is that this patient who presents with you with early cardiac arrhythmias, that needs ventilatory supports early on when they present, or that has the severe metabolic acidosis, usually these patients will last longer and require longer or have a higher mortality rates. So management is PPE, because you need to protect yourself as a first responder or a medical care provider. Usually you want to keep them in negative pressure rooms because, as we mentioned, it can aerosolize and it can be inhaled as phosphine gas. Go through your ABCs, your airway, your breathing, and your circulation. Make sure you have enough circulatory support with good renal excretion. So give them maintenance IV fluids, run your pressors or inotropes as much as you need, and then do your electrolytes corrections if any. We know by anyone that kind of works in the ED that we usually rely on activated charcoal in a certain time period in many intentional ingestions or accidental ingestion that in the stomach. However, in this case, the activated charcoal has a wide internal surface area, which helps moderate molecular weight, which is like 100 to 800. However, alkaline phosphine is about 58, so it's smaller than that of the activated charcoal, so it can't leak through it, so it doesn't help. Sometimes they use the potassium permanganate, which can oxidize phosphine to non-toxic substances. You'll see them use a medicated liquid paraffin oil, which basically accelerates excretions from GI through diarrhea, or causes non-immiscible with fat. So basically causes, you'll see that the phosphine gas is, the phosphine molecule will be here, and then it will basically cause that miscible molecule as we see in most lipid emulsification therapy. And it's highly alkaline, so it helps also interact with the acidity of the stomach and prevents the conversion to phosphine gas. Coconut oil with bicarb gavage kind of helps as a coating the layer, preventing the acidity and interacting and diluting the HCl, the hydrochloric. Some management. Multiple papers you'll see talk about all of that, and the main management is the supportive treatments. However, there has been talks about magnesium sulfate and how it works by scavenging that free radicals through glutathione recovery, and it's one of those things that are affected in the cellular energy production, and usually just magnesium sulfate in general helps with membrane stabilizing. Usually doses varies, but the most one I've seen repeated over and over again is that 1 gram that you give stat, and then you give 1 gram every hour for the next 2 hours, and then you kind of vary where you give 1 to 1.5 grams every 6 hours for about 5 to 7 days. And then I've seen recent studies that also talk about NAC and using an anti-angina agent like trimetazidine because it shows improvement if given early. And it's kind of the same mechanism where it works through glutathione recovery, because if you think of it, it's the same way it works with acetaminophen toxicity in a way. So it's not basically the same mechanism of action. It's kind of drugs differently, but not here how glutathione recovery as well. And we have seen that the half-life of aluminum phosphide is about 3 to 5 days. So that's why you mostly see that it's excreted in the body through renal excretions by 5 days, and that's why you see the most recovery of those patients. So that being said, part of that what happened during the instance in those family was the topic of organ donation. I found very scarce resources about it, but basically the recommendations that I've read, and this is not 100% accurate, so don't take me for it. This is just my research about it. It says if you wash the bodies with Clorox and scrub and betadine, donation is acceptable in certain organs. So you can donate the bone, the soft tissue, the heart valves, but do not use the lungs or the livers. And you cannot use the heart muscle, but you can use the heart valves in itself. Because remember, one of the most affected organs is going to be lungs and the heart. So basically, if you have questions, just post it, let me know. If you think there is an improvement or that an information that was mismentioned or misunderstood, please let me know. We can review it, we can edit it, and then we'll do better next time. I hope you benefited. It's a short lecture to the point. It was more of an interesting and dear lecture to myself personally from previous experiences, and I hope that was helpful and beneficial. Thank you.